The changes brought upon by aging affect our entire being, and especially the efficiency in the functioning of our body's systems. The production of hormones is one of the areas that are greatly impacted, and it wreaks havoc with our daily life. Hormone replacement therapy has been used in medicine in order to help balance the hormones and help us live a fulfilled life. So to better explain how this is done, especially in men, is Dr. Mark Opperman from the T Clinic. Welcome, Dr. Mark. Thank you so much for joining us again.
Hello, Michael.
Now, Mark, we have discussed testosterone in men in quite a lot of detail, but let's just recap and touch on it slightly again in terms of why you would need to replace hormones specifically.
In men, as in women, hormones, especially testosterone, start decreasing from our mid-30s, maybe even a little bit younger than that. And with that, it results in a decline in sexual function, mental function, and well-being.
Yes.
So by supplementing or optimizing these levels again, we restore the body's functioning to a younger, more youthful state.
Okay. Now, you mentioned testosterone specifically in men, but now testosterone is not the only hormone that exists in the body. So if you do hormone therapy for testosterone specifically, what is the impact on the other hormones potentially in the body?
Well, one of the things that we need to realize is that most of our hormone systems are linked to one another.
Okay.
Testosterone, for instance, is a steroid hormone. So your steroid hormones would include your thyroid, your estrogen, some of your corticosteroids and adrenal hormones. So they're all steroid hormones, and they come from cholesterol.
Okay.
So it stands to reason, if you don't have optimal and healthy cholesterol, that your steroid hormones that come from this would suffer.
Okay.
Changing one of the steroid hormones has a knock-on effect on all of your other steroid hormones.
Okay.
So it's not as easy as just, okay, let's supplement testosterone or let's supplement estrogen.
Yes.
The biggest problem that I'm faced with in my practice is that testosterone converts into estrogen in men. Okay. So by supplementing testosterone, I have an effect on the estrogen levels, which is what creates the most difficulty for me to rectify.
Yes. So I suppose the body in general is a finely tuned machine. So this system of hormones is exactly the same.
Absolutely. I describe it to my patients as walking a tightrope in the dark, an open umbrella in one hand and a dumbbell in the other hand. And you know what, someone just to be funny is tweaking the line.
And so what do you do to identify when hormone therapy is necessary and also to maintain that balance? How is it tested? What's the process?
So the very first thing that I start with patients in my practice is a detailed blood examination. You know it, and this will include everything from testosterone levels to estrogen levels, progesterone, which is the mother of all our steroid hormones. Then I look at the stress hormones as well, insulin, vitamin D, iron. These things affect various systems in the body. For instance, it elevates red blood cell count, so we have to know what your full blood count. It can have an effect on your prostate-specific antigen, so we look at PSA levels. So it's not as easy as just looking at testosterone and thinking I'm going to supplement testosterone, or supplementing testosterone and not knowing what the effects of this is going to have on other systems in the body, like fertility, for instance.
From what you kind of read and what you hear in general conversation, you'd think that testosterone has a positive impact on fertility. When does it become a negative impact?
The moment that we start supplementing with testosterone in high doses, you start suppressing the natural functioning of the hormone cascade. So if we look down, testosterone for me has two main pathways that we follow. The one is the steroid pathway, which we spoke about. And that will affect your other sex hormones. The other part is that you have your hypophyseal gonadal axis. So it comes from the brain. And there you impact fertility directly, where you stop the production of luteinizing hormone, which leads to decreased production in sperm.
So would that be guys who go to the gym and they doing a lot of weight training that take testosterone
especially at a young age. You know,
okay.
but we affect fertility,
Yes.
and this can be something that's affected irreversibly.
Okay, so it can have long-term
So
effects.
you know, it's easy to get a testosterone, and it's very easy to give a testosterone injection.
Yes.
But to manage the complications of that, one injection is a lifetime.
Okay, so now let's talk about that, the therapy that you offer at the clinic. What is it, a more holistic sort of way that you operate in to look at the whole system, the body, the lifestyle? What is included?
I'm glad that you mentioned holistic, because that's exactly what it is. When we look at a holistic approach to this, we look at all the possible angles that can be affected.
Okay.
This is from lifestyle to diet
Right.
to supplementation.
Okay, okay.
So you have to have a very good understanding of what your patient is dealing with and what your patient is presenting with.
Yes.
A patient that presents with under 40 or even in their early 40s is completely different to a patient that presents in their 60s.
Okay, I can imagine.
We have to look at different things.
Yes.
So, as I said, we start with a blood request and a detailed analysis of that.
Yes.
Then the patient comes back and we have a physical examination to see that everything is as it's supposed to be. From there on, you know what, I work out a protocol according to the patient's imbalances.
I know previously we have touched on them, but let's just refresh some of the lifestyle factors as well that I imagine you would look at as part of this holistic approach, from diet, exercise, nutrition, things like that. How big is the impact, and how, when you start to change the hormones, do you have to change those?
You know what, I think the impact is much bigger than we realized.
Okay.
On my way here this morning, my IT and my marketing person said to me, you know what, he just went and he Googled a little bit about plastics.
Yes.
And how that affects hormone levels, not only testosterone, but all the other hormone levels. And it's scary. It's scary how many studies there are out there that say how we are polluting ourselves and our bodies by using artificial things.
Okay.
I think it's incredibly difficult to get away from these things because it's ingrained in our lifestyle
It's
at the moment.
everywhere, yeah.
But you know what? It's a real problem. Lifestyle definitely affects, and it's not just what you eat.
Yes.
It's where you get your food from.
Absolutely.
How your food is packaged.
Yes.
And then what you do with your food at home.
Okay.
Somehow there's a study that says that warming your food up in plastic has an impact on the estrogen levels that's in your food.
Yes.
And you know what, as a man, that's the last thing that I want to put into my body is extra estrogen.
Yeah.
Soy, for instance, changes into, or is a catalyst for changing testosterone into estrogen.
If I start a hormone treatment therapy, how long does it take for things to come right?
What I tell the patients that walk into my office when they ask me that specific question is, there's a reason your testosterone levels are low at this age, in any case. So supplementing with testosterone will elevate the levels until you stop supplementing.
Okay.
And then we will have a gradual decline to levels as low as, and sometimes lower than we started.
Okay, okay.
So choose your treatment very carefully, because most of these will be lifelong.
Okay.
Supplementing testosterone in a controlled, efficient manner means that you will never have to stop.
Okay.
If I think of an anti-aging perspective from this, we are going to live longer whether we choose to or not.
Yeah.
Living longer in a healthy body with a healthy mind is going to become essential if we're going to live to 100.
Absolutely.
I cannot suddenly retire at the age of 70 and think that I'm going to sit in my rocking chair.
Yeah.
You know, I will have to be physically and mentally active until well into my 80s so that I can retire with some kind of assurance that I will have food on my table and will not be a burden on the rest of my family and on society.
Absolutely.
So for me, that's one of the biggest things that testosterone plays a role in, is it keeps me strong.
Yes.
And I've said this many times before, the biggest effect of testosterone is on higher function on the brain.
Yes.
It keeps my mental faculties so much better than at any other stage of my life.
Yes.
if we optimize them.
Absolutely. Now, Mark, one of the big aspects of testosterone in a man's body and big functioning aspect is sexual health. So what is the difference between this kind of hormonal therapy versus a quick fix like a blue or a red pill, as a lot of men do kind of encounter?
So a decline in testosterone has, as a result, and most probably one of the most noticeable for men, a decline in sexual functioning, and mostly so in libido.
Right.
Now, the products that we have, the erectile function or dysfunction products that we have on the market, as you refer to the blue and the orange pill, does not have an increase in libido as target.
Right.
You know,
Yeah.
it targets erectile functioning.
Yes. Okay.
So with these things, you still need to have sexual stimulation
Right.
for them to work.
Okay.
Whereas with testosterone supplementation or testosterone optimization, you increase libido, so your sexual desire increases,
Yes.
which makes it easier for you and your partner to engage in sexual relations.
Okay. Mark, where can we get hold of you if anyone is looking for more information about this therapy?
Okay, so we have two established practices. The one is in Park Moor in Johannesburg, and the other one is in Pretoria.
Right.
I am very happy to announce on Real Health that we are opening a clinic now in Umhlanga.
Fantastic.
So, you know, the people in KwaZulu-Natal would be able to get hold of us.
Great stuff.
The easiest way is to get hold of us on one of our mobile numbers.
Okay.
They can speak to Dante on 083-284-7575,
Right.
or Alice at my rooms in Johannesburg on 011-784-1168. The website, very easy, www.thetclinic.com.
Wonderful. Thank you so much, Dr. Mark. Great to have you here.
Thank you, Michael.
Cool.